Hello. Sanibona sithandwa zami, sanibona sithandwa zika Dr. Nomcebo Mthembu. Hello my loves, hello my sweethearts. Sanibona sithandwa zika Dr. Nomcebo Mthembu. Welcome to your sacred space. Welcome to Dr. Nomcebo Mthembu Network. Welcome to your home. Welcome to your home of hearts, where we heal hearts and we move the hips and we make the lips communicate the right thing in the right way that we need to connect with our partners, but also find ourselves as we begin to heal in this journey of love and sexual relationships. Mina ngu Dr. Nomcebo Mthembu. I am your GPS in love. I am your GPS and your coach when it comes to the bedroom. And you are intimate with me, Dr. Nomcebo Mthembu. Welcome, Sithandwa Zami. As you are joining, remember to tell me where you are joining me from. I'm sending you love. Send me love back. Welcome to your sacred space. It is 6 o'clock on Sunday, and of course, there's always going to be some sex in this house at this time. So, Sithandwa Zami, remember that during the week, just to recap, when I was with Umam Lady D, we had it was an open line on Ukhozi FM, and kwakhona ubaba okhala ngokuthi uyavuza ngemuva. That was quite emotional, but I hope ukuthi we were able to help him. Athi kuvuza indle ngemuva, and he was quite ashamed. He was afraid ukuthi it might be cancer. And I know as we are celebrating Men's Month, I'm always saying, men, I see you, I hear you, but you need to speak up. You need to stand up for yourself so that things don't get delayed and hibernate and grow zikhule ngaphakathi kuwena ziqhamuke sezeyinto engaka nje. So whatever it is, do not be afraid of being ill, because being ill, and if your body is speaking, it is not a sign of weakness. It's just your body telling you that, hey, I'm here, look at me. Hey, I'm here, concentrate, ngibheke, kuze usize ungilaphe. So as abantu besilisa, very important, please, hamba no check, nento encane nje, check, but also talk, communicate, but that is also part of you just offloading, so that we, the women, your friends, your lovers, we are here to hold the space for you. And I, as a Dr. Mthembu, I am here to hold this sacred hour for you today, as we'll be talking about the prostate. Again, I want to talk about the prostate because so many men, out of fear, think that if you say prostate, the first thing they say is cancer. Kandi, no, prostate is just this beautiful gland that you have inside of you. And today I'm going to be delving into the prostate, and I'm going to be telling you about the prostate, the symptoms, but more, of course, I am with Dr. Nomcebo Mthembu. You know that I'm going to be delving into the sexual symptoms of a prostate. What is the sexual symptoms of a prostate? But more, what are the things you have to do and can do? And what are the sex positions that you can do if you're having that discomfort? So, Sithandwa Zami, as you are joining in, as you're telling me where you are joining me from, I'm hollering back at you and I'm saying hello and I'm saying welcome to your sacred space with me, Dr. Nomcebo Mthembu. But Sithandwa Zami, some house rules and some boundaries to always remember on this platform. We do not shame anybody. Asinyezi muntu, asihleki muntu, asinyezi futhi asekho umuntu esimenza ukuthi afile emncane. We do not shame anyone, but we just speak the truth and we mix that with science and our cultural identity so that our people learn and they know. Because once you learn and you are informed, then you can make the right decisions in wherever you are. Of course, we speak the things that are not just spoken anyway. On this platform, we say it as it is, real talk, but at the end of the day, it's building talk. That is what we are doing. So, before we get into our topic today, Sithandwa Zami, go grab your cup of coffee or whatever cup you want to grab. Maybe it's just your person next to you. Sit down with a nice warm blanket. This is your time. This is your sacred space. Let's talk about it. Let's talk about the prostate. Let's talk about the things about the prostate that are not spoken about. And I know you want to know, Dr. Mthembu, how does the prostate affect me in the bedroom? And today we're going right there. We're going deep. We're going real. We are going into the prostate health and how it affects you in the bedroom. Stay tuned. Okay, sithandwa zami, so prostate uyazi ukuthi last week I went ngakhuluma ehostela somewhere ngibuza abantu, do you know what in prostate, and they're all like, asazi. Oh guys, I've been speaking about the prostate for so many years now. I think it's been 8 years on radio I've been speaking about it, but I will not get tired to speak about it because it's a very important gland. Ekhona kuwena umuntu wesilisa, every man has it, so it's a very important gland. So as it's Men Awareness Month here in South Africa, we are going to be talking about the prostate today and how it affects you sexually, how it affects you in bed, but also how it just affects you in real life overall. Okay, so to explain the prostate and what it is, I have brought my friend here. Okay, this lovely picture, let's see so that you have a nice image of it. I think you can see it is. Here is the prostate, or the picture, you know, of my friend here. I call him, you can call him Vusmoz, okay? In English that means Vusa is to awaken. So whatever it is, he awakens things, okay? Awakening within the household, all right? So this is a lovely picture so that I can explain to you about the prostate. As you can see, this is the prostate here. Okay, that's the prostate. It's a small little gland. Okay, it's a gland. It's not too small. It's the size of a walnut, so maybe it's about that big. Okay, and for us as doctors, obviously we are able to feel it the minute if we put our fingers from the rectum, we're able to feel it. But I know men are so afraid of those fingers going in their backside. Now, of course, there's other tests that you can go and do, which is a blood test, the PSA. I'm going to talk about that, but here is the prostate. But also, just to dispel some myths, you cannot see the prostate from outside, okay? And you cannot feel it also from outside. But once you have a problem with the prostate, you can feel it all over in your whole body, starting in your head. You know, you will feel, when I say in your head, I mean mentally, psychologically, because it can definitely affect your mood, because it will affect your sexual performance, all right? So, as you can see, the prostate is right there, okay? I'm just making sure the reflection is good there. Okay, the prostate, there's the prostate, that yellow gland, which is just below the nice pink black gland organ here. That is the bladder. Njengobubona nje lana ithi bladder isinya sakho lesi. This holds urine, isinya siphatha umchamo, okay? This holds urine, and that holds semen, okay? This is umchamo wase toilet, le umchamo wase kameleni. Okay? This holds urine when you go to the toilet. This holds another fluid for when you ejaculate during your orgasm. All right? So as you can see, if I can just explain this just a little bit, these are your testes, all right? Your testes, that is where your body makes the sperm, logo pugudayo, okay? And then from there, the sperm only will then move up, okay, and then collect lapayana in your prostate, and then your prostate will then form le fluid le okuyiyona oyikhiphayo ukuthi masuyachama umuntu wesilisa, okay? So that is how it works. So the prostate will then form some of the fluids which you ejaculate, okay? Of course, some of them are also coming from your testes, all right? Now, what happens when you have a problem with your prostate, okay? Now, looking vele from the position where it is, you can see it's directly just below the bladder. So many of our symptoms that you will feel because your prostate has a problem will be problems around the bladder. So, and it's going to be problem along peeing. So because of where it is, you're going to feel symptoms to do with your bladder and peeing. You're going to feel symptoms to do with your penis and whatever else your penis does, whether it's peeing or whether it's in the bedroom, you will feel symptoms there if there's a problem with your prostate, okay? So the first symptoms or the early symptoms that you might feel, I generally say, you know what, the first symptoms are generally sexually in bed, but let's start with the physical symptoms, all right? Physical symptoms, if your prostate is enlarged, because again, let me stress this, just because your prostate has a problem, it does not mean it has cancer. Okay, because with some men, the minute you say you've got a prostate problem, they're like, oh, I've got cancer. No, there's so many things that can go wrong with the prostate. Okay, your prostate can just be enlarged. Okay, we call that BPH, benign prostatic hyperplasia. Okay, or it can be infected. We call that prostatitis. Okay, or it can have cancer, okay? But that's not the first thing. That is why I'm saying always hambu yo cheka kuqala, so that you make sure that you're not delaying it until something sinister does happen. All right. So, for example, if guguti your prostate is just enlarged, here it is. If your prostate is just enlarged, meaning uti vuvgele prostate yako, what is it going to do? What you'll be feeling mainly if it's just enlarged is pressure. Okay, because it's occupying space now because it's enlarged. So you're going to feel pressure. Where you're going to feel the pressure, number one, obviously in relation to your bladder. Kumbulu guti, for you to feel like you want to pee, all right, it's because your bladder senses the pressure within the bladder. Then the bladder knows, oh, I must pee because of the pressure. But now, if your prostate is enlarged, it exerts and puts pressure on your bladder. So your bladder is also going to be getting signals that it's full, it's getting pressure. So you're going to have an urgency to pee. Every now and then you want to pee. You're not peeing because there's lots of urine, but you're peeing because the pressure is coming from your prostate now rather than it coming from within the bladder. Then you're going to have an urgency to pee. That's number one. And when you do get to the toilet, sometimes you feel like, hey, I've only peed just a little bit, but I keep wanting to pee, but only a little bit is coming out. That's because the volume that is from here wasn't that much, but the pressure was coming from your prostate, okay? But then again, kumbulu guti, from your prostate, through the prostate runs, you can see through here, this is the urethra, okay? This is le tumbuleli elkipa umchamo out of the bladder, through the prostate, through your penis, and out. So if she or he, whatever you want to call your prostate, is swollen or inflamed, then it's going to put pressure, even nalogumtambo lo, your urethra is also going to have pressure, then your urine won't be able to flow smoothly. So when you get to the toilet, the next thing that's going to happen, you're going to feel as if you need to push your urine just a little bit for it to flow. Okay, so kuba ngathi ungakhanula qala, right? Then when you are peeing, because also there's a little bit of blockage here, it's as if your urine is staggering, your urine is dripping, like stop, start, stop, start, stop, start. So it's not a constant flow, and the flow of your urine is not a flow yakhona ayikho like steady, loko kuthi izoshaya le kude kuba ngathi iyadriblisha and ishayela la eduze. Okay, so the stream is a close stream, okay, almost like it's dripping, all right, because of the fact that your prostate has now also put pressure on your urethra, okay, which is now sending urine out through your penis, all right? But then what happens, because the pressure of the prostate is still there, still putting pressure on your bladder, uzoti, when you're finished peeing, you will still feel as if there's still some urine there. You'd have stopped, and the minute you want to put up your zip, you feel as if, hey, I still need to pee again, and you push again. Or you find that you're peeing so much longer because you feel like it's not totally empty. There's still something that is left behind. Kanti, that feeling is still the prostate putting pressure on your bladder, ezokwenza kube ngathi kukhona into esele kunokusalela okhona kumchamo kuwena ngaphakathi. All right? Now, that is just if your prostate is swollen. But if your prostate is, yes, swollen, when it's just swollen, it's generally with older men. All right, but nowadays, every man must be able to check it because the prostate can affect anybody. And there's many mixed symptoms as well. Also, with younger men, they generally get what we call prostatitis, meaning a prostate ivuvgele, meaning your prostate is just inflamed, all right? Because of infection, maybe, kumbula, wherever you go and you put your ding-a-ling-ling, okay, it can pick up dirt, and that dirt can go and infect your prostate as well. So when ivuvgele, especially for the younger men, when your prostate is swollen, what you will feel as well, you might feel a burning when you pee, all right? So when you pee, you might feel a burning because now there's now infection and inflammation, that is related to that. So meaning on top of the other symptoms that I spoke about earlier of the inflamed or of the swollen prostate, you will also have burning if it's infected for younger men. And now, if there's cancer, then you begin to have pain now. okay? You begin to have pain, and it then affects so many other things, and not just the prostate. It begins to affect the lower abdomen part. You know, sometimes you might even feel pain on your back. You might even feel pain on your thighs as well. Just referred pain going to all those areas, because your prostate is inflamed, your prostate is infected, or your prostate even has cancer. You will feel pain in all those other areas as well. All right? So, Stanozami, I know we are going to how it affects the bedroom, because remember, when I said that your prostate carries the semen, which is the fluid that you ejaculate, which is the fluid that comes out, prostate will definitely also affect your performance in bed, but also it will affect your ejaculation, okay? It will affect your ejaculant, meaning either what you ejaculate, because it's sick, it won't produce so much fluid. So what that means is your semen volume will be less, okay? Or you might even feel like it's dripping from somewhere, it's coming from far, you know, it's not jet springing out, okay? Or you might feel that the volume is little, or even the feeling of arousal. You might feel like you're not really getting to that threshold of you getting a strong orgasm, because your prostate is also involved in part of you feeling the orgasm, and your muscles contract and relax. Your prostate also is involved in that area of you getting an orgasm. So when it's infected or inflamed or infected, it will definitely affect how you perform. It will affect your orgasm as well. All right. Now, while I'm talking, I'm going to put this down, but I want to go now sexually. Here we are, and we are having sex. How is an inflamed or infected or a prostate with cancer going to affect you as the man in bed? All right. Now, as I said earlier, as you know that your prostate works together with your penis and all your other organs, your male organs, when you are having intercourse and when you're having sex. All right. So one of the major things it's going to do, it's going to disrupt your semen. Okay. The flow of your semen, the pressure of your semen, and how much semen is actually coming out of your penis when you orgasm. Sometimes even a block it, such that when you have sex, absolutely no semen actually comes out at all. We call that a dry ejaculation, so a dry orgasm. So that can also happen, and when that happens, it then begins to affect you and how you see yourself as a man. Because I know many men see themselves, hey, there's so much semen that came out of me, that's my manhood, and that is not true. You know, your semen is not an evaluation of what kind of a man and how much a man you are. You are still a man. But when your body is not secreting enough semen, it's your body saying, hey, listen to me, hear me, there is something wrong, and you need to look at that and we need to fix it. All right? So it's definitely going to affect how you see yourself as a man. It's going to affect your confidence, okay? Obviously, if you know, you're having sex but nothing is coming out, it's going to affect your confidence. But of course, it's going to affect your mood, because sometimes when your prostate is inflamed, you might feel pain. And there's no way that when you're feeling pain, you're going to feel pleasure also at the same time. It will affect your mood. It will affect your confidence, okay? But also the fact that you need to wake up, that alone is going to affect your confidence in yourself, okay? And also that retention, because sometimes when you have your erection, just before you penetrate, you then have the urge again to pee, and that disturbs the mood, and that alone will also affect you and how you see yourself. It will affect your mood and your arousal, but also it then begins to affect your relationship with your partner. So, one of the first signs or symptoms of a prostate, with my experience and that I'm seeing recently, is signs in the bedroom. All right? So, what is going to happen in the bedroom? One, there's going to be pain, okay? Now, any kind of pain, whether that pain is on your thighs or on your back, all of that is going to affect your arousal. So it's going to affect your desire and you wanting to have sex, because when there's pain, you're not going to have a desire. You're not going to be having a longing to have sex because there's some pain somewhere around your sexual organ, okay? But also, you're going to feel pain when you ejaculate, and that's the commonest, okay? That when you ejaculate, or when you orgasm, you're going to feel some kind of burning pain or a stinging pain, or even immediately after, you feel a pulling pain after you've ejaculated. That is a sign that your prostate is speaking. Your prostate is saying something. And I know for many men, when you have a burning pain, you always think, oh, it's your urine. Let me take something to calm my urine, and alkalinizer to alkalinize my urine. No, sometimes it's your prostate speaking, saying something is wrong. I need you to listen to me. I need you to attend to me. Okay? It's the pain. Another thing that will happen that will also affect you sexually is the volume, as I said earlier. Because your prostate is the organ that makes the fluid, which is the semen, when you ejaculate, then the volume will be affected, the volume of semen that is coming out. So that will happen either when your prostate is inflamed, either if your prostate is infected, or if you have prostate cancer, you will still see that the volume that you are ejaculating will be much less. And when that happens, also when it's inflamed, you might feel that your ejaculation, or when you orgasm, it's not satisfactory. You've orgasmed, but you haven't felt to that high as if it was as powerful. So meaning your orgasm becomes weak, or absolutely no orgasm at all. Those are signs also that you're having problems with the prostate. Another sign that you might overlook is erectile dysfunction, okay? Remember, because of the position of where the prostate is, there's a lot of nerves, there's a lot of nerves and blood supply that's going to your penis. So when the prostate is inflamed, it's going to affect the nerves and blood supply going to your penis. And remember, I always say the penis, it's blood. The more blood it gets, the more it wakes up and stands and says, here I am. So when the nerve supply to the penis, or when the blood supply igazi nomcebo eya to your penis, when those are affected because of your prostate yakho ivuvukele, izokwenza yenza induku yakho ingasasebenzi kahle, then what will happen is your arousal induku yakho ayibe strong. You have an arousal, but it is soft, it's not hard enough, okay? You don't feel satisfied with it, or your penis does stand up, it does get aroused, but also it just swiftly and slowly just begins to lose its strength. Kanti, it's losing it because of the pressure that your prostate is pressing on the blood supply that is going there. And that obviously is going to cause a lot of anxiety, which then goes and affects your confidence, and then your confidence again is going to affect your performance in bed, okay? So then that becomes a feedback, a feedback loop. One is feeding into another. So you have to know that it's not always that your erectile dysfunction is because of your penis. Sometimes your erectile dysfunction is because of your prostate. Okay? So whether umncane or umdala, kungenzeka ukuthi induku yakho ayisebenzi kahle nje, problem iku-prostate, hayi kodwa kumphambili, meaning ukuthi inkinga before even ufike kumphambili. And of course izokwenza futhi prostate ukuthi ungabi nje nenkanuko, okay, ungahaleli. One nje wade ngishilo eqaleni ukuthi uba ne-pain ne-discomfort, but also emotionally ugcina nawe ungasabi nokuhalela ukwenza umdavazo, so izokwenza induku yakho futhi ukuthi ungahali. Okunye okukhulu ezokwenza futhi ekameleni izokwenza ukuthi njengoba ngishilo earlier on ukuthi isidoda sakho sizoba weak, but also uzogcina udelaya ungasafiki kuvuthondaba. Ulokwenzile uzobona ukuthi ayi sengithi ngiyakhathala ngayeka. So you keep going on and on until you just get tired. You feel like, you know what, I'm just not feeling that effect for me to orgasm. That's because of the prostate probably pressing on some important nerves that make you feel that excitement. Then you have a very delayed round, okay? Or you have absolutely no ejaculation at all until uzuyeke nje at all. So it takes very long to come, or you end up not coming at all until you just get tired and you let go. Sometimes, because again of the position of the bladder, which is just near there. Sometimes the semen will be here, so kusho ukuthi uketshezi lizoba khona la isidoda, but kunokuthi liphume size ngapha siyaduka, okay, silahlekelwe GPS, sikhuphuke sihambe siyohlala esinyeni. All right, so what happens sometimes, I'll just say that in English, is that you will have semen, your prostate will form the semen, but instead of your semen going out through your penis when you ejaculate, it loses GPS, all right, and then it goes up to your bladder. We call that retrograde ejaculation, okay? It goes up into your bladder and it stays there and waits for when you pee, then only it comes out. And then you'll notice that sometimes when you pee after sex, then, you know, your pee is a little bit cloudy and there's stuff in your pee, Ganti. It's because your semen got lost and it went up to your bladder instead of coming out through your penis, and you might find that either you ejaculated a little volume of semen came out, or no semen at all, okay? Of course, other things can cause that retrograde ejaculation where isidoda sakho goes to your bladder. There's some medication that can cause that, blood pressure medication, prostate medication, because we must remember, even medication, yeah, your prostate can affect you. Surgery on the prostate will also affect you and affect, you know, your performance in bed, but also just other nerve problems around that area can also cause ukuthi you have retrograde, meaning your semen goes up to your bladder and does not come out through your penis. All right, now I want to talk about which sex positions, okay? Which sex positions should you do to alleviate the pressure of the prostate, to alleviate the pain that comes with an inflamed prostate, but also the loss of confidence that comes with an inflamed prostate? That we will talk about after this. Okay, let's get to the juicy part now of solving the problem. Let's say ngampela now you have a problem and your prostate is limiting your movement, is limiting your sexual desire, is limiting your erection, is limiting your ejaculation, your orgasm. What do you do? What do you do firstly in the bedroom? What positions can you do? All right. Of course, if there's discomfort anywhere, that will affect your performance in bed, okay? But with the right positions, okay, we can reduce the pain and increase the pleasure, okay? So, what do we do? What are the positions that are best for you if you already have prostate problems, okay? Best positions, by no doubt, should be positions where you are not having to thrust too much. So it's positions that was going to have less pressure on your back, okay? Less pressure also on your prostate. Kumbulu guti, here it is, okay? So remember that when you are lying facing, let's say you're doing this, men on top, okay? Here's your prostate. This can have a risk of also still putting pressure onto your penis. Okay, that can then cause your penis ukuthi itikati mesi yawo. All right, so best positions you can do is, number one, you can have a position of, we call spooning, which is side by side. Okay, so side by side means like this. This is actually a side by side. Okay, so there's less pressure on you to thrust. There's less pressure on your back. There's less pressure on your hips. Okay, so as you are thrusting also, when it's side by side, you can't be thrusting too much. So it's a nice and controlled rhythm, which is tight knit. Now a foot, your hands are, it's also a connection, movement as you are side by side. Maybe your partner is you both facing one direction. You can have your hands around her And during that time, as much as you are thrusting her nice and slow rhythm, okay, from the back, but also you're playing, with your hands. Either you're using your hands around her neck, you've got your hands in her mouth, and you're allowing her to suck your hands. So akufende when izandla umfende wena, you thrusting into these lips, okay, while your penis is thrusting into those lips, okay. You're playing with her breasts at the same time, down her navel, inkaba yakhe, uye enkomeni yakhe. You're still playing with the clitoris while you are inside her. So there's touching her thighs. So the side by side, the spooning allows you to do so much else, to make that connection even more between the two of you, while putting less pressure on all the organs wena umuntu wesilisa that can cause pain, that can cause pressure, okay? 2, you can also have the woman on top. But the woman on top actually allows you, uguti, you are more relaxed. And when you relax also, which means we then creating, there's more blood flow when you are relaxed. So then you're going to have a stronger erection, obviously, when you are relaxed and there's no tension, even if that tension is, mental tension. When you are relaxed, you can have a stronger erection, okay, because there's more blood flow. You are relaxed and you're just concentrating on just the movement. The woman is in control. The woman is controlling everything, okay? But also, should you have any pain when you are lying flat on your back, let's say you are lying and she's on top, put a pillow, okay, where's my picture? Okay, put a pillow, okay, underneath your back, okay? That way it's going to lift, all right? When you put the pillow, lift it that way. It's going to lift your penis that way. Then you don't have your movements up and down. Your thrusting is not from a flat angle. It's from a certain angle. So you're just moving just little tilt up and down without creating a big angle shift in ukufenda kwakho. So ufendi kakhulu, ufenda kahle njengoba manje if kukuthi usufake iphilo nawe kumhlani wakho ngaphansi komhlani, kusho ukuthi lokho izokwenza njani isinqa sakho sizothi ukhuphuka, umphambili wakho usubheke phezulu. Uyabona usubheke phezulu kumphambili wakho, usho ukuthi usuzomukela yona ke manje inkomo. So kulula ukuthi nyoma ufenda uthi nje kancane awusalinyakazisi kakhulu ka iqolo, ngoba manje wena unenkinga yeqolo ngenxa ukuthi prostate yakho ivuvukela. So having the woman on top is also another way to alleviate any pain and pressures that come with thrusting if you've got a prostate problem. But of course, you can use the same pillow again in missionary, okay? When the woman is ngaphansi and you are on top, all right? During missionary and the man is on top, you can use the same pillow under the woman's ass or under the woman's bum also to lift. That way, also, her bum and her vagina and her vulva is closer to you. That way, there isn't a big gap of you having to thrust. You're just having nice and slower rhythmic movements because you've actually tilted her pelvis up to come and meet you halfway so that you don't have too much pressure in pumping when you are thrusting inside of her, okay? But also, the pillow also allows you, when you're doing missionary, remember, take it slow, okay? Take it nice and slow and shallow, because if you're going too deep, but also if you're thrusting too much, that's going to precipitate and start the pain. Manje suqala ubuhlungu ke manje ngenxa ukuthi wena you've been pushing too much and you are thrusting too much, all right? So now, if you are thrusting too much and you're feeling you need to push too much, add a little bit of lube, because adding lube makes the friction less. Then as you're going inside her, it's smoother. You don't have to feel like you're banging and pushing inside her. The lube is going to help that slow, rhythmic motion of movement. All right. Okay, you could also do the sitting position where you are sitting as the man and then the woman straddles over you, okay? When uhleli, and then lo wesifazane agovozele ngaphezulu kwakho. That also allows, also make sure your chair has got a nice back, behind it, so it's giving you back support. That is also going to help to support all your organs. Your pelvis is nice and relaxed, your hips are nice and relaxed, and she's doing all the movement, maybe you moving her onto you more than you are moving onto her. So that's also going to put a little bit of pressure or reduce the pressure of your prostate that's inflamed. Or you can pull her towards the end of the bed, all right? That also reduces the pressure of you. Or if you're on top, hold onto something, hold onto the headboard if you have a headboard which you can hold onto. Or bring her legs up and hold onto her legs. That way you're not bending too much. So that's going to create less pressure on your back if your prostate is inflamed, therefore putting less pressure on all your pelvic muscles. Then you'll be able, those positions will be able to help you to perform better. All right. Remember, the doggy dog style, that's going to put a lot of pressure on your back, okay? That's going to put a lot of pressure on your back. So if you're having problems with your prostate, try to just reduce on the doggy dog style. But also just some tips that you can do. When you're going to have sex, just some tips. When you're going to have sex, try to pee before you have sex. That way you won't have that pressure to pee just before you enter her, just before you penetrate, because that'll dampen the mood and destroy the whole flavor of what you're trying to, of your connection. All right. So pee before you have sex is one. Again, I said using lube, that's going to help to reduce the friction. All right. When you use lube, that helps to reduce the friction. But try not to have sex when you've got flare-ups, whether that flare-up is your back is painful or anywhere, your pelvic, your lower abdomen. If there's pain anywhere, try not to have sex. You can have other kinds of sex without using your penis. You know, you can have oral sex, you can use your hand, you can, make it a time to just reconnect in all the other areas of your body without penetration. So go easy on penetration when you have flare-ups, okay? But also in between rounds, from round 1 to round 2, if you're having a prostate problem, have a gap, in between the next round. And I know for many men, because I know many of you come to me and you complain that, hey, my refractory period, which is the time between round 1 and round 2, is very short. So if you've got prostate problem, tell your partner, Dr. Mthembu said, we must just give that period some time before we have a next round, so that it helps to relax you and to calm down any of the flared muscles or flared, if there's any inflammation. Then only you can do the next round. So in between round 1 and round 2, try and have a gap and some time in between that time, just to help to support you during your problems with your prostate. But you know what, as Tandozam, more than anything, communicate. Communicate with your partner. Communicate with your partner about what feels painful. Don't hold it in. Don't say, I'm going to continue anyway just so that she orgasms. It's not just about her, it's about the two of you as well, all right? Communicate when you feel pain, but also communicate when you feel pleasure, so that she knows what it is that works and what doesn't, because it's out of communication that the two of you begin to build a beautiful environment in your bedroom, whether the prostate is giving you problems or not, okay? But more than anything, Tandozami, remember, if your prostate is giving you problems, despite what I'm saying do this, but at the same time, you have to go to your doctor to have it checked out so that it is correctly managed. So our management of you, okay, our men, as Tandozami, is not complete without us saying, what else can you do at home? Besides seeing me as a doctor, besides going to your doctor, what else can you do at home just to help to support your prostate health, okay? There's foods that you can do, all right, which are good to help to support your prostate health. Pumpkin seeds. Where we grew up, pumpkin seeds, in our African communities, our grandmothers used always take the pumpkin seeds and dry them up and eat them. You have to eat pumpkin seeds. Don't look down on pumpkin seeds. Take them, you can dry them, you can roast them, you can eat them as nuts if they are roasted, or you can even soak them the night before, and in the next morning you blend it and you put it into your smoothie and you have it with whatever else in the next morning. It's very good for you. The pumpkin seeds, it's going to help. It's because it's got zinc, okay? So it's going to help to heal your prostate. It's going to help with the inflammation, all right? So it's very good for prostate health if you're taking pumpkin seeds. The next thing you can do is take lots of tomatoes, okay? Because tomatoes have got a chemical called lycopene, okay? The chemical leguma tomatoes. It's very good for your prostate health. It's good for the flow of urine yako. So you can have a tomato every day. You can have it raw. You can have it cooked. Have your tomatoes. It's very good so that you have that chemical, which is very good for your prostate health, to protect your prostate. It's also very good for your skin, and it's good for your heart, as well as protecting your prostate. Okay, go easy on the fizzy drinks, go easy on the alcohol, all right? Go easy on the smoking. Instead, drink things like green tea. Green tea is very good for you. Have a cup of green tea every day. It's going to be good for you. Use turmeric. Okay, turmeric, remember, it's an anti-inflammatory. All right, turmeric is very good. You can have it in your tea, have it in your food. So have turmeric. It's an anti-inflammatory and izokwehlisa ukuthi ungavuvukali prostate yakho. So as you have turmeric, it's also going to help your system yakho nokuflow nje kwegazi. It's good for the nerve supply also. So what you're going to do for your turmeric, you're going to take half a teaspoon of a turmeric, maybe in a cup of whatever else you are drinking. Remember, when you take turmeric, just add a pinch of black pepper. Black pepper, it helps the turmeric for absorption. So your body will absorb more of the turmeric if you're adding a little bit of black pepper to it. So having turmeric as well is good. And then I mentioned the green tea, but also to remember to stay away from the other things. Stay away from the wrong things. Stay away from smoking. Reduce your alcohol intake. Drink lots of water. That way you are flushing your system. Reduce your caffeine. But even more, do not hold your urine. Don't hold your urine for long. If you notice that it's been a whole day you haven't peed, even if there's no urgency, just go and pee, because you know you are just cleaning and you're servicing all your engine pathways, lapayana, ama tubes akho, so you're servicing yourself. So go and pee even if you don't have an urgency to pee. Of course, if you want herbal supplements, you can use Isopamento. Isopamento is very good. You can find it in a chemist. It's very good for urine flow. It's good for prostate health, all right? You can use that as a supplement every day, but also it will help also with your semen and all the other things I spoke about earlier with your ejaculation. So taking Isopamento as a supplement is also very good for your prostate health.
It's time to reset with Medilution Wellness Retreat. This September, we are opening our space for the very first time, and you are invited. Choose your journey. A 21-day therapeutic wellness retreat for deep emotional healing, trauma recovery, and full transformation. Or our new 7-day mental reset program for those needing agent support, clarity, and peace, but can't take 3 weeks off. Set in tranquil nature, our retreat offers natural therapies, nourishing meals, mindfulness practices, and professional doctors, psychologists, and medical support to help you come home to yourself. Spaces are limited, medical aid or private rates available on request. To book or inquire, send us a WhatsApp on 072 994 7547 or DM us the word HEAL. Your healing begins now.
Okay, yes, thandwa zami, in closing, remember ukuthi umzimba wakho awusiyi injini. Okay, umzimba wakho uyakudinga ukuthi ukwazi ukuthi ucheke, okay, physically, but also ukuthi ucheke emotionally. Uyazi ke mesikhuluma ngezomdavaza ukuthi ngihlala ngisho ngokubaleka, so ukuthi ukwazi ukuthi uzinake wena emotionally first, to be emotionally there for yourself so that you are able to be emotionally there for your partner and sexually there for your partner. That is why also I have created a safe space where you can reset, where you can offload, where you can reconnect with your body physically, emotionally, and sexually. Medilution Wellness Retreat, okay? Especially manje as Men's Month, I'm talking a lot about mental well-being, yamadoda. if you need to just offload in a place which is safe and private, where you find a specialist doctors, psychologists, psychiatrists to help you walk whatever path that you need to work on mentally, Medilution Wellness Retreat is there. Call us, make a booking in number Z2. Let me get the numbers. Our phone number is 072 994 7547. All right, we've got a specialist team of doctors, clinicians, and everyone who's there just waiting for you to find your power with us, and let us help to build you and to build your health with you and your sexual enhancement with us through Medilution Wellness Retreat. So ngiyabonga kakhulu sithandwa zami. I know ukuthi this time I spoke a lot of English, all right? But it's mainly because I know there's a lot of English listeners also who are always saying, please speak English, speak English. But also, into prostate is such an important topic that I feel everyone needs to hear it in a very universal language. But Nina Gesanazamzo Kozi on Ukozi FM this coming Thursday, I will be talking about the prostate again, and I'll be speaking about it in Zulu, Koze uyizwe kahle yonke lento ebengiyikhuluma. Kodwa ngiyanazi nina nesilungu ne George niyamuzwa msinengizwile ukuthi bengithini. Kodwa ke ningasenda nama questions that you have, and on Thursday on Ukozi FM I'll be going deeper and deeper on a topic here to your prostate. Thank you Tanazami, thank you for holding the space. Thank you for being here. Thank you for listening. Thank you for the comments. Remember to like and subscribe to channel Liami. I will see you on Tuesday. We'll have 9:30 Nomam Lady Day on Ukozi FM, and I will see you Thursday night at 10:15. See Nomshengu with Sex Talk, not Dr. Mthembu, Eza Selawini Ngolwesini. But then again on Sunday, next Sunday at 6 o'clock, there will be yet another section of sex with Dr. Nomcebo Mthembu. At 6 o'clock, you are going to be intimate with me, Dr. Nomcebo Mthembu. Have a good night and have a wonderful week.
It's time to reset with Medilution Wellness Retreat. This September, we are opening our space for the very first time, and you are invited. Choose your journey. A 21-day therapeutic wellness retreat for deep emotional healing, trauma recovery, and full transformation. Or our new 7-day mental reset program for those needing agent support, clarity, and peace, but can't take 3 weeks off. Set in tranquil nature, our retreat offers natural therapies, nourishing meals, mindfulness practices, and professional doctors, psychologists, and medical support to help you come home to yourself. Spaces are limited, medical aid or private rates available on request. To book or inquire, send us a WhatsApp on 072 994 7547 or DM us the word HEAL. Your healing begins now.